Perfect. Thank you, Lisa. Thank you, everyone, for joining tonight. I know I love seeing where everybody's from. That's super cool that everybody is from all over the country and out of the country. So welcome. So as Lisa said, we're gonna have a conversation tonight. We'll go for about 50 minutes, and then we'll have a little 10-minute discussion at the end. But what I want to do tonight really is just kind of debunk some uh, areas of concerns that we have as dentists around treating our patients with anxiety or neurodiversity or neurosensitivity. And just to kind of give y'all just a brief overview of kind of who I am and what why am I here. So I've been doing this for a couple of decades, but the biggest thing for me is I'm a general dentist. I'm not a specialist of any kind, but I am a special needs dad. My son Ethan is on the spectrum, and so for the past 21 years, I have been on this special needs residency, as I say, learning more and more about not only the world of autism and special needs, but now more the world of neurodiversity and neurosensitivity, and really how that translates into every patient that comes into my practice. And so, hopefully, my goal tonight is just to give y'all a glimpse into ways that we can really kind of alter our typical approach to dentistry that will not only help us be a little more introspective on who we are, and how we look at certain patients that come into our practice that we may view as challenging, or even just demanding, but really there's an underlying source of those problems or those concerns, which is really more sensory. So uh, we'll start with just a few definitions, and really just kind of get some verbiage out there. The first one is the term neurodiversity, and I'm sure a lot of y'all have heard this term. If not, it is the new generalized term that basically says, like your fingerprints, everybody's brain is unique. There is variations to it, but there's no lesser than. So just in the case of what falls in the category of neurodiversity, you're going to see something like this wheel, where if you would normally hear the term neurodiversity, you may think of things like intellectual developmental disabilities like autism, Downs, even where we're getting into situations where we have sensory issues, or common things like uh, defiance disorder, ADHD. But if you really look at those, think about the patients that you have that fall on this: anxiety, depression, even gifted. I like to tell people I consider everyone neurodiverse because we're all somewhere on this wheel. And as dentists or dental providers, uh, I would like to say we're all gifted in a certain way. Got us to where we are. But at some point, too, we all fall into certain categories here. Like for myself, I'm going to say I have a little OCD to me. How many of y'all, really go back over that prep multiple times? So we all have our fit into this neurodiverse wheel. And so the second term that I really want to highlight tonight is the term neurosensitivity. And when you look at neurosensitivities, it has more to do with both internal, external sensitivities, how we process the world around us, and how we respond to that. So a lot of us will think about this a little differently when we're done tonight, because not only do you have to realize that we get so much sensory input during our day, and we have to process that, and we have to be able to come up with a normal, or a what we would consider a typical response. that we think that's the only way to respond to it. So I'm going to go through a lot of the different sensory issues and obviously the senses themselves. And hopefully there's some things in here that may be new to you. That'll give you a different perspective on some of the ways that you manage things, but also some of the ways that your patients manage their experience in your office. So um, I'll definitely touch on special needs. We hear that term a lot. So special needs identifies a person that requires a type of specialized care, very individualized to them, and that can be obviously physical, mental, behavioral, emotional. And so, we say the term special needs, and we think obviously intellectually and developmentally disabled. But if you have someone that comes in as special needs, this could be a variety of your patients, which I'll show you here as a list of different types of special needs patients. So obviously the IDD patients top the list, but what about think about your pediatric patients, your geriatric patients, all special needs, because you have to adapt how you, as a general dentist, do general dentistry to that group. And this may be as simple as you have a patient, for example, a geriatric patient that can't transfer out of their wheelchair. You may also have a pediatric patient that won't sit in your chair. So you have to adapt your environment to help that group get the dental work they need, but also create a sensory friendly environment. So you'll see a lot of these groups on here that you go, oh, well, I guess that makes me a special needs dentist. It does. A lot of people say, well, I'm not a special needs dentist. Yes, you are, because you see this population every day. And when we get into what dentistry is for most people, it's what Mr. Nash says here. Some tortures are physical and some are mental, but dental is both. And you have those patients that it terrifies them to come into our offices just to get the basic cleaning and exam done. And you have no idea why they're white knuckling your chair, or why they're breaking out into a cold sweat, or why some patients react differently to certain treatments when some seem to tolerate it just fine. So when we're looking at the term dental anxiety, which really kind of comes to the top of the list for a lot of us that maybe don't see a whole lot of special needs patients, or I'll even filter it down to intellectually and developmentally disabled patients. But we all see patients with dental anxiety. Up to 80% reports show that people in the US have some form of dental anxiety when going to the dentist. And if you look at the list here, you can see there is something on that list that you heard probably today from a patient. And they'll say, I don't like needles. I don't like pain. That tastes bad. That smells bad. The drill sounds bad. Yes, I use the term violation of all senses. Going to the dentist violates all of them. And, we have to find a way to damper that a little bit and really make the patient experience more than just sit down, shut up, open your mouth, and let me do my job. Because I'll tell you this, folks, if you take nothing away from this tonight, realize this. If you're a dental provider, you have spent your life doing education, going through dental school, learning how to be great at your craft. And everybody who's come out of dental school has at least had to have a level of patient care in fixing teeth and comprehensive dentistry. But what it doesn't teach us is how to be good at reading people and how to manage people in your practice. So hopefully some of what I'm going to go over tonight will really kind of give you a new insight and maybe a different approach than what you're currently doing. So it all starts with our senses. And in my bigger classes, when we really deep dive into this, we go through a lot of the subsections of this, which are your biases, your personality type, and how we all have our perception and perspectives of different things, but all of those things are affected by our senses. And so your patients have that as well. For example, you could do the best crown, the best filling, the best extraction in the world, but if a patient is uncomfortable, whether that the light was too bright, the the sounds were too loud, or even someone was talking in the hall that disrupted them and made them uncomfortable, it can make your dentistry obsolete. And that's why you see things on social media all the time where they say, well, there was nothing wrong with the dental work, but just the experience wasn't what I expected. And we as dental providers have to be able to not only provide quality dentistry, but we have to provide a quality experience. And that really comes with understanding what the sensory integration in our world in the dental office really translates to our patients. So, one other thing that I always find amusing is how our emotions and our senses really tend to be very intertwined. And think about it this way: if you have somebody that comes in and they are just as happy as can be, and they're happy to be there, and they talk to you, and you're like, man, this is great. We're having a good appointment, and something goes wrong. Something just may not have gone ideally. Those patients are going to be less likely to have a negative response or reaction to that sensory experience because their emotions were in a positive. Just on the opposite, you could be the best give them the best clinical outcome, but if there was something that they walked in with that created a negative emotion, and I'll give you an example for me today. I had a patient, did an extraction, went flawlessly, atraumatic, no problems. Patient didn't feel a thing, but her complaint was, I wish the people at the front would have told me my insurance wasn't going to cover all of this. And I'm like, okay, it had nothing to do with my dentistry. Her emotions made the experience not necessarily ideal. So every aspect of your dental practice, every team member plays a part in this experience for our patient. So let's talk about the senses. And maybe this is going to be new to some of y'all. Maybe y'all know this already, but this is the five senses, the external senses that we're taught in school: sight, smell, taste, touch, sound. And we can all look at this really easily and go, yes, I can think right off the top of my head a handful of things in my dental office that would annoy people in each of those external categories. But what a lot of us don't know is that there are three internal senses that are very specific to each person. So proprioception, vestibular, and interoceptive. And I'll give you a brief definition of what those are. So proprioception really is kind of where your body is in space. It's how your joints and your ligaments tell you how things are, where what you're doing. And vestibular is movement. Vestibular is where your head is in space. And interoceptive is the internal signals. That's I'm hot, I'm cold, I'm hungry, I'm not. Something hurts, something doesn't. And part of those sensory experiences uh, all culminate into a term that we call sensory integration. And sensory integration is basically taking all eight of those senses that come at us. Some come at us all at the same time, some of us individually, but we have to take that and we have to organize it in our brains and then respond what we consider appropriately. Now, here's the problem: what's appropriate to you and I may not be appropriate to someone else on that wheel of neurodiversity. So for example, I use the analogy of one big satellite dish. So for most people in the appropriate what we would consider neurotypical response, everything comes into that one satellite dish. We're able to process it, and then we're able to provide a response or a behavior that is considered appropriate. So, for example, we're having this conversation right now. Y'all are getting a lot of information. You hear my voice, you see me on the screen. You've got things in your own homes or offices that's going on right now that's distracting. But you're able to sit here and still focus on what we're talking about. That would be considered appropriate. But for some, that overload of information can be overwhelming, and that leads to non-appropriate behaviors. So when we talk about the term sensory processing disorder, we have to think about what that really means. It's I'm getting so much stimulation. I'm getting all of these things that are coming at me, and think of it like someone who's got 4 or 5, 10 different satellite dishes on the top of their roof, trying to all get signals in, and they're each of them are not communicating with each other, and you're trying to decipher which one to respond to. And when you get that, it creates a sensitivity that can be exaggerated or really under exaggerated. Um, when you hear the term sensory overload, this is my son Ethan back when he was younger. This is us about 2 o'clock at Disney World, right when everything is basically just hit the fan and he is just done for the day. And so it didn't matter what toy we gave him, it didn't matter where we took him to. There was just so much going on that he couldn't process it properly. And when that happens, it triggers fight, flight, or freeze. Now, think about this for yourself. I'll give you an example that happens in my office on a daily basis. Is I'm with a patient, and then um, I have my focus on that patient. I have an assistant come, puts me a note down, says, "We're ready for you in the next room." Then the next assistant comes and says, "We're ready for you in the next room." And then my office manager comes and says, "Hey, doc, when you're done, I need to talk to you about a patient on the phone." And there's so much coming at you at one time that the first response you have is, if someone else comes and talks to me, I end up biting their head off. Or you just shut down and you're like, I need a minute. I'm going to step away. I've got to go take some time to kind of woosah and kind of get myself back on par. And so this is one of the situations that happens in a lot of careers. It happens in our daily lives for everybody that has kids. Think about it when it's, the mom, dad, mom, dad, mom, dad. Then you got, phone ringing, you got a dog barking, you got all this other stuff. And at some point, you just got to step away from it. And that's what sensory overload is for our brains. It's just too much to handle at one time. And so, what are the common causes of sensory overload? You're thinking of things like loud noises, crowded spaces, environmental changes, unwanted contact, tactile triggers, and intense smells. Now, think about this. If you look at that list, you're going to go, "Yep, that's my office. I'm pretty sure I can check the box on every one of those in my own office on where, as a dental provider and a dental practice, we pretty much can violate all of those, and sometimes simultaneously, to really cause our patients that increased sensory experience and anxiety." So there's two other terms with that sensory overload that we talk about: sensory hypersensitivity, or we call it uh, sensory avoidance, or sensory hyposensitivity, or sensory seeking. So I love this picture. I tell people when you go to a theme park and they take a picture of you riding a roller coaster and it's $20 at the end and nobody buys it, this is the only picture I've ever taken the time to actually purchase. And I'll tell you why. because this highlights the sensory hypo and hypersensitivities to a T. So if you look at the picture, the elderly gentleman in the front, don't know him, just part of the ride. The young lady and the older lady next to each other, that is my daughter and my mother-in-law. Myself and my son Ethan, who's hanging on for dear life because he's like, why did you make me ride this? And my wife Jennifer is the pretty lady in the back. Now, if you were to say who is hyper and hypo, I'm going to go with my daughter and my mother-in-law are really more in the hyper sensitive. They have a pretty exaggerated response to the ride. I would say my wife and I are pretty typical, appropriate. Even Ethan is just kind of holding on with not a whole lot of extra. But the little boy in the orange shirt, if y'all look at that, now this is that part of the ride that we're going down the hill. If you look at him, he looks just to be as bored as can be. And I say, like, if you want to look what a serial killer looks like as a young person, that's the look right there. But very, very just neutral to what most people would consider a sensory overload type experience. So let's talk about what your patient's dental experience looks like from their perspective, because I know from my perspective, boy, everything looks good in my office. Everything is appropriate. We have nice furniture, we have nice chairs, we have all the technology in the world, very modern, and yet we always seem to get that one situation to where you walk into the patient and you're like, hi, my name is Dr. Dent. How are you? And they go, nothing personal, but I hate you. And I'm like, what other career allows people to come in and say that to you before you even get started? And I realized quickly, this was in my career, I realized quickly part of it was because I never made a personal connection with the patient in the beginning of their appointment, because I was always the person at the end of the appointment. It was always assistant went and got the patient, then they went to x-rays, then they went to see the hygienist, and then after the hygienist, 5 minutes at the end of their appointment, I'd go in, do the diagnosing, treatment planning, say the ladies at the front will tell you how much your insurance is going to cover, and we'll get you scheduled. And that was our entire um, approach to building a relationship with our patients. So no wonder why they really didn't have that initial, boy, I really like Dr. Dent. Boy, he's such a nice guy. They didn't know me. All I was the guy was told him what was wrong and how much it was going to cost. So when you think about your patient, you know, we they're going to look at your waiting room like this. Or maybe when your assistant brings them to x-rays, you ever heard him say, how many of these are we going to take tonight, or today? They don't understand the process because we never framed it up for them. We really didn't give them a customized plan based off of what their needs were because we didn't see them. We never engaged them early in their appointment. So all of their anxiety is constantly building throughout the appointment until we get there and we're like, okay, you want to do that today? In a couple of minutes, they got to decide, do they like you? Do they trust you? And are they mentally and physically prepared to do the work today? And so when we start to look at those eight senses and the sensory sensitivities as in regards to your dental office, I broke it down. I've given you a couple of suggestions here just to kind of let you know what a lot of people deal with. So sounds. We can all think about sounds in our office right now that just annoy the heck out of people. Not just your dental drills, but this could be as simple as your office music. It could be your staff talking, or other patients in your office talking. This could be even as easy as, hey, you know what? I hear a hum. I don't know if it's the lights. I don't know if it's the air condition. I don't know if it's your ultrasonic in the lab, but something is just annoying me. Sights, sounds, just like sounds, the sights are overhead fluorescence. A lot of patients that are sight hypersensitive actually can look at your fluorescence and it looks like a strobe light instead of a continuous light. Aversions to touch. Um, one of the worst things about dentistry for a lot of people is we violate their personal space a lot. And when you look at certain touches or textures, you can see things. And for example, I put bib on there. Like my son has a hypersensitivity to the tags in his clothes, and so if we don't know that, if we haven't asked those questions, then someone like my son who's on the spectrum goes into your office and you put a bib on them just thinking, hey, this is just routine. This is how we do it all the time. And he's going to have a meltdown right there. Your appointment's over. And good luck getting it back. Um, Taste, nothing in dentistry tastes good. Smell, we had one of these. I just gave a class this past weekend in North Carolina, and we had a poll of what was the worst smell in a dental office, and the top two were an old crown that you're drilling the old glue out of, or changing the plaster trap in the lab. Those were the two big winners. But think about when you look at this, think about some things like perfume or cologne, because a lot of us, we don't want to stink going because we're in people's personal space, but sometimes what we think smells good can be offensive to other people. So those are your external senses. But I want to show you what internally hypo and hyper look like. So vestibular, like I said, that's where your head is in space. So if you've ever had a patient that is sitting in your chair and you start to lean the chair back and they jump, they're hypersensitive to vestibular. So how would you overcome that? Very simply, just lay the chair back and let them lay down instead of moving it. Uh, Proprioception. This is where you would have the patient that looks like a fish out of water and just keeps flip flopping in your chair, or has trouble keeping their mouth open. It's the one, oh, open, open, open. Would you like a bite block? Open. Part of that is if they are unaware of where their position is. Remember, proprioception is the joints and ligaments that tell you where you are. So some people are very hyposensitive to that. So they can't tell if they're keeping their mouth open. They may be also hypersensitive, and that's the person that, or the child especially, that tends to move in your chair and can't sit for a long time. And you're going, oh God, they haven't just diagnosed that they are ADHD yet. Proprioception plays a role for a lot of us in our careers, because we think just because we're up and moving room to room and patient to patient, that, oh, everything must be fine. But if you ever see that patient that you walk in and they're not even sitting in their chair, they're kind of pacing, guaranteed they have a proprioception sensory issue. And then interoceptive, this one's really interesting, not just from the fact that, hey, this is the person that can't really tell if they're hungry or full, at this point, but think about it from the perception of you've got somebody that you do the same injection the same way to every patient, and one person jumps out the chair, swears that you just stabbed them with a harpoon, and then the other one just lays there like you hadn't done anything. And you're like, man, what's going on? It is an interoceptive hyper and hyposensitivity. So that just gives you kind of a brief overview of the sensory experience that your patients have in your office. So we must adapt our environment and the delivery of dentistry to our patients instead of making them adapt to us. So if you look at these two pictures, these are two of my patients. Um, Both of these patients are special needs and neurodiverse. But the gentleman to the left is actually one of my adult patients. They travel 3 hours one way just to come to my office to clean his teeth because he will not sit in a dental chair in my office. I have to go to the parking lot and brush his teeth just like you see in a chair by his vehicle. Very compliant when it's outside in his comfort zone, very aggressive when he's in my office. And then for the little one that is on the right picture, very simply, this was a patient that was very medically compromised, had a lot of dental issues, but unfortunately, in this situation, she could not be put in a dental chair and stabilized, which she needed to do her dental work because in this case, she just had back surgery and the sutures didn't close on her back, so she couldn't lay flat. So we had to adapt, use her stroller, and kind of do it in a catcher's position on the floor. But instead of making it all about me and what was comfortable to me, I try to adapt my methods the best I can in the environment to help people really get the care they need, but in an environment that was comfortable to them. So I want to introduce what I call the patient-centric approach. So this starts with the doctor going to the patient in the waiting room, grabbing them, and actually having a little brief 5-minute conversation around, hey, what can I do to be of service to you? We have their health history. We know what their medical issues are, but a lot of times people don't put everything on there. Maybe they're embarrassed. Maybe they just are fearful of what you're going to judge them for. And so having that initial rapport and being more of an active listener and being very, very empathetic towards their situation instead of here's what's wrong, here's how much, let's get it started. You'll immediately reduce their anxiety levels before your appointment has even started. And so looking at what really adaptations we have to make into our office, it all starts with our approach to the patient. And when we talk about things in customizing that appointment, there are going to be things that I'm going to show you some tools, some technology that's really going to help this, and obviously some, minimally invasive dental treatments that will help people that have those sensory situations or sensory hypersensitivities that really make the situation so much worse than it has to be. And so some modern technology, and we'll go over that today. Just give you a couple little situations that I've used this technology in that's really made a big deal for the patient. That they are now part of that treatment plan, and they can see it, they can understand it. Other than us just pointing at a black and white bite wing, going, "Well, this is your problem." And then I'm going to give you just a couple of preventive products that I use. And I will tell everybody this, everything in these slides are what I use in my private practice. If anybody has any questions afterwards, I'm happy to answer them. So we want to talk about creating a sensory-friendly environment and space, also a sensory-friendly schedule. We have what I told you before is a medical history. We all get one. But one of the things that we don't have is a dental sensory profile. Now, I'm actually working with a company right now that y'all may know, Sensodyne, and we are developing a sensory profile that y'all will eventually be able to download and put into your practice free of charge, just to really help y'all get those questions answered that will help you tailor your appointment to the patient and avoid a lot of these anxiety-causing situations. Desensitization, and then obviously the technology and diagnostic tools that we use in my practice, and then just some minimally invasive treatment options and some products there. So this is actually my sensory room. This was my sensory room in my Houston practice. And so this was my waiting room. And I developed it and I designed it in a way that kind of looked like my son's sensory room. There's nothing in here that's scary. There's a lot of areas and seating options here that reflected what they patients may have at home or at school or in, say therapy that can be replicated. And that's the big thing for a lot of our dental appointments is if we're going to desensitize a patient that is anxious about being in a dental office, we have to be able to create a routine that can be replicated at home or at school or in therapy. So this is my treatment bay or my open bay. And I'll just touch real quickly on a couple of things that are now catching your eye. I had three different delivery options, an ortho bench. Why? Because that's for the vestibular patient that can't lean back without getting anxious, so they can just lay straight on that. That also gives me the option to use a stabilization board, like a Joey board, if necessary. We have a mobile cart. Mobile carts are going to be for my wheelchair patients that can't transfer. Or, as you see, there's a blow-up canoe there. That's actually a sensory canoe. So kids get in there, kind of gives them that firm pressure squeeze. But they like to play in it, so I would just let them play with it in the front and then kind of just move it to the back, and I would just brush their teeth in that. So it didn't have to be in my chair. And then obviously you have a traditional dental chair. But we've got a play rug in there because, like I said, I do a lot of floor dentistry and preventive care. And then the trampoline, because that patient that needs that movement, whether that be vestibular or just needs a little more input proprioception, so they can get all of the sensory input and it kind of calms their brain. They can sit longer and be still longer in your chair if you give them an outlet that they can kind of fulfill that sensory diet that they're needing. So, what are sensory friendly hours in my office? Every Monday from 8 to 12 are what I call my sensory friendly hours. And that allows me, what I do is I schedule fewer patients. I adjust the environment in the office, like turning the lights off and no music, but also I make the appointments very minimal because I don't want to have to stop one, go to another. Because a lot of my families that I see that have um, neurosensitivities, neurodiversities, like my IDD patients, for example, the biggest thing that you can give them that's going to make the difference is your time. And if you're trying to see three people in an hour, it's not gonna be effective. And I know, again, as a business owner, I own 13 offices. I get it. But if you want to create a child that's going to turn into an adult that's not going to have dental anxiety, that's not going to be requiring to go to a hospital or be sedated or stabilized, you have to give them the time in the beginning to overcome some of those issues, to figure out what those issues are, and to help desensitize them with a little collaborative care approach that's with the parents, with therapists, teachers, doctors, GPs. We're all on the same team here. So, so when I said a dental sensory profile, I have one I use right now in my office, and it asks questions about their home care, their previous dental experiences, diet. What I'm looking for is little pearls that aren't direct questions. Like, for example, do you use a manual or electric toothbrush? Okay. Why should we ask that? Because if someone's sensory issue is to the vibrations of an electric toothbrush, I would like my hygienist to know that before they pick up a Profi cup and start trying to polish their teeth. You ask the patient, what flavor Profi paste would you like? Or I hope you do. But sometimes these patients, it's not the Profi paste flavor as much as it is the grit that will bother them. So there's a lot of things with a sensory profile that will help you as a provider really avoid a lot of those anxiety causing situations. So desensitization, like I said, this is kind of what it looks like in my office. And what that entails is just adapting my approach and meeting the patient where they are. So I'm on the floor, I'm in the waiting room. It really, like I said, makes me no difference. But for the patient, they're more comfortable, which makes them more compliant. So what is desensitization? It's a behavior therapy that works on principles of operant conditioning as well as positive reinforcement. Um, when you look at, yes, you have a treasure chest in your office for the kids that do well. That's a positive reinforcer. But you don't bring them to the treasure chest before they actually did their procedure. That's bribery. And when we start talking about how do we build on these desensitization appointments, well, I'm going to make it up to the point where the patient's getting that sensory overload, and I'm going to back up one step, affirm it, reinforce it positively, and then I'm going to tell the parents or caregivers, this is what we have to work on until I see you back at your next visit. So part of it is just we're working with progress, not perfection. And in the world of neurodiversity, neurosensitivity, anxiety, all that is just we're building blocks of positive. So you'll always know when someone has dental anxiety, let's just say it's a neurotypical patient, and they're going to go, yes, I know I need that crown, I need an extraction, I need this, I need that, I need scaling. Yeah, can I just get a treatment plan of that? And I'm going to go home and talk to my spouse, or I'm going to go think about it. And all you see is them walking out your door, and you get nothing, from that patient. Um, I invented what's called a dental desensitization kit. This is what I give our families with special needs that they can go and practice going to the dentist at home. And there's 10 items in it, and it just goes over a basic exam and cleaning. And every item in there has a sensory counterpart and what we're trying to overcome. But again, it's tools. We have to have a toolkit that gives us information that is non-invasive. So um, one of the big tests that I've incorporated in my practice is salivary diagnostics. I want to know what my patient is, what bacteria I'm dealing with and how to treat it properly. Because one of the things with special needs is I can't always get periocharting. It's not comfortable for anybody, but especially those with intellectual and developmental disabilities. Kind of hard to say, I'm going to stab you 60 times and I need you to sit still. So, salivary diagnostics really help capture what bacteria are causing the gum infections or cavities. And when we talk about minimally invasive dentistry, this is a big upcoming topic right now. I know the ADA has put out a lot of information about how the old school extension for prevention is not necessarily applicable at all times anymore, and we have materials and processes that we can use that really minimize the need for invasive dentistry. Y'all have all heard of silver modified atraumatic restorative treatment. So using silver diamine fluoride and glass ionomers, this eliminates the need for a lot of drilling. It eliminates the need for a lot of injections, and it also prevents patients from having to overcome their sensitivities or anxieties day one. It buys you time. Another one that's come out is Papakari Duo. Actually, just used this today. So this is more of an enzymatic caries removal. So there's no shots, no drills. It's all hand instruments. But you just put this on the tooth, and only thing it's going to take out is the infected dentin that you can scoop with a spoon excavator, and then you fill it with a glass ionomer. Just as simple as that. And I know for me, trust me, I was that same way. Like, no, that's not what I was taught. If I see a stain, if I see discoloration, I got to drill it out. That's what, or it's not going to be a good restoration. And some of this is just you got to overcome some of the base knowledge that we got in school. Air abrasion, there's new and better air abrasion units out there. I like this one from Cavo because it has water spray around it. Some of the old school air abrasions, it was like you and the patient were both on the beach because there was so much sand everywhere. We have products like Curodont, that we can remineralize teeth now with incipient decay versus just drilling or just watching it till it turned into a cavity. Icon, resin infiltration for white spots. Again, non-invasive, not causing us any type of shots or drills, but really gives the patient a better experience when it comes to uh, treating their dental issues without the invasive dental treatment. Um, and as we get towards the end, we're going to talk about technology. In my office, I use these three CBCTs. Um, just I don't know how I did dentistry without CBCTs. We have digital scanners. We use CEREC. I know iTero is another great one. And then I use, an intraoral cam, the Diagnocam, just to help me diagnose things, but also things like the Diagnocam, they give you a intraoral photo like these that the patient can see. So you can show a patient this picture and go, hey, look, there it is, as opposed to a bite wing where like I don't see it. You know, this is also great for my young associates that are not real confident in their diagnosis on a bite wing. This really helps. You can also do it as a fluorescence, and I do a lot of SDF in my practice. And so one of the things that I try to do is I try to make sure that is that SDF still arresting the decay, or is that decay now active? And the fluorescence view from the Dynacam really helps me with that. Um, Obviously, AI has now kind of come into the forefront of dentistry. Um, it's it's very humbling if you look at your diagnosis off a traditional bite wing and then click AI and watch how much you missed. I did a test with Pearl 2 weeks ago before I went and taught the AGD course in North Carolina, and I think I got like a 60. So like I failed. I wouldn't. I mean, I was like, man, I thought I was pretty good at this, and but it's amazing how much I missed. What I really enjoy around AI in my practice is that it gives the patient the opportunity to trust your diagnosis because it makes it very objective. There's no subjectivity to what you're telling the patient, so that increases your case acceptance. It increases the patient's confidence in you, and it helps people start their treatment sooner. So the things that have really been a big help for me: perio diagnosis, and is a cavity incipient, or do I need to fill it? Those have been the big two. Um, they have a version for kids. It's cute. Kids like sugar bugs, and so it doesn't have to be scary, which again helps with the anxiety. And then when I give a patient the opportunity to say, okay, here's what we're going to do moving forward, and part of that desensitization, we talk about toothbrushes. There's a variety of toothbrushes out there. Um, there's basically the top four. There's a three-sided toothbrush for your patients that have dexterity issues. And I'll give you a quick pearl. If a patient can't tie their shoes, they cannot use a traditional round or regular bristle brush because they do not have the dexterity to roll it. You have a full arch brush, or you have the great electrics like Sonicare or Oral-B. Water flossers, also great. A lot of our sensory patients, like my special needs patients and my autism patients, water is a soother, so they love showers and baths. So they can get a water flosser that mounts to the shower head, and the parents and caregivers can just do it in the shower. So that makes that super simple. And then a couple of preventive products that y'all are all using. Prescription toothpaste is a great one. MI paste, again, various forms of that for remineralization, and obviously the MI ones, that have fluoride in it, and it's all in one instead of having to do it in brushing and then the paste. Varnish, again, so many. Varnish is texture and flavors, and there's a lot of varnishes out there that have different types of stickiness to it. You have the patient that complains about how sticky your varnish is, but some of it is just the flavoring. And then poviodine. I don't know if y'all have seen this one. This is one that I give patients that are high caries risk, that are high perio risk. It's once a month. They do it at home, and it's a broad spectrum antiseptic. It's been around forever. but it allows the patient who has struggles with oral health care or caregivers that struggle with brushing and oral health at home. So that would be like your Alzheimer's dementia patients, your kids that are on the spectrum or just defiant that don't want to brush. This really kind of takes that compliance out the window and helps keep that bacteria at a good level. And then you look at things, these are over the counter supplements by Primal Health. Again, they've done the studies with this. It's all natural, but this actually keeps the bacteria at a low level, and there's no compliance. It's mints. It's dissolvable mints or dissolvable water packets. So a lot of things, but it takes care of all 11 of those bacteria that we find that are in that red complex all the way down to the green complex. And then lastly, easy stuff, xylitol products. One thing I keep for kids is I keep those Zollipops in my office just so they have something as a reward and a positive reinforcer. They don't know that it's helping their teeth. So again, little things like that go a long way to help reduce the anxiety for your patients, keep them healthy, and overcome a lot of those behavioral and compliance issues. So to finish up, again, words of wisdom. Um, Working with this population of neurodiverse, anxious, and neurosensitive takes a lot more emotional skills than dental skills. And I know for me, emotional skills, it drains me because it's not my personality. I'm a D, I'm a get in, get it done, go on to the next. And so you will find you have to slow yourself down. You have to make really more effort than it is just to numb them up, drill and fill. And then again, progress, not perfection. Unfortunately, dentistry is one of those careers where it's either perfect or it's trash. And I think that's why we burn out so much in this career. If you get to that thought process of this patient population requires you to be human, which means it's okay to not get it all. It's okay to not get it all done at one time. So give yourself some grace is what I'm encouraging you to do. So questions. We are at the end of our time. So I would love to answer any questions that you have. Just put them in the chat. I'll be happy to answer them. Um, as you can see, if you can see behind me, my wife and I are Harry Potter fans. So we built a Harry Potter Airbnb. So that's why I'm sitting in our living room of the Harry Potter Airbnb at our house. So um, questions, anything that I can answer for you, please feel free to let me know. Uh, in the meantime, I will flip to my last slide here, which is just my information. If anybody has any questions or anybody would like any information about anything in this webinar, please let me know. I'll be happy to shoot you any of that information. But again, thank you for the time. I know it's late on a Thursday, so but thank you for your attention, and I hope everybody got a little something out of it today.
All right. And I thank you so much. And yes, please, you can type your questions into the Q&A box if you could, please. And Dr. Dent, I do see a couple in the Q&A box right now, and I'm happy to read them if you need. How is your back and neck doing with all the non-dental chair dentistry?
I keep my chiropractor in business, but it's not bad, because I'm moving. I'm not stagnant in one certain position. But yes, I don't care if you're sitting in a chair. Dental ergonomics is a fallacy in my world. But at almost 47 and 22 years in, I'm still holding up.
Okay, next question. I had an assistant and that did not like me holding patients' head with my palm for taking denture impressions and extracting the teeth. She said it was very inappropriate and she spread gossip about it. What would you do?
I'd promote that assistant to patient. uh, I would ask, well, two things. One, were you doing it because the patient compliance, or were you doing it to stabilize the patient so they didn't move during your impression? I think in those cases, because I've had to explain some of the way I do things with my staff, especially my new staff, because there's a fear factor, or maybe it's again it's a perspective, and they may be seeing what you're doing as intrusive or unnecessary. So sometimes, again, it's kind of that same scenario of like, talk through it. What is it about, my technique that bothers you so much? But at the end of the day, again, if you as the provider feel like that's going to give you your best clinical outcome and the patient is okay with it, then do what you do.
And a little more elaboration to her question. She just asked, what would you do, I guess, differently to stabilize if you needed?
I mean, if we're talking just a traditional patient, instead of putting my hand on the patient's forehead, a lot of times I'll just get behind the patient and kind of use more of my right-handed. So I'll use my left hand to stabilize if I tend to see that their head is a little bit mobile. Now, I'll also tell you that if you have a patient that is um, severely, non-compliant, and you're trying to get an impression and they're moving, something you may think about is, if they're not compliant to an impression, are they going to be compliant to whatever you're trying to deliver? I haven't gotten a whole lot of success out of removable with patients that are intellectually or developmentally disabled. So I'm not sure the patient type that we were talking about, but now if it's just a neurotypical patient, like I said, your technique for taking impressions is up to you. I mean, I do everything scanned, so I don't necessarily have to hold them, but we have to be still so we get good imaging.
Do you recommend perio trays?
Perio trays for compliant patients are great. You have things like Perio Protect, where you have to make custom trays, and I think maybe that's a good thing to. If a lot of my patients that are special needs or developmentally disabled, um, if they can remove it, they will not keep it in their mouth. Now, if you have more of a mild, say someone who's mild on the autism spectrum that is verbal, you can communicate that we need to leave it in. Sure, that's fine. But a lot of times, what we would do as a treatment plan for someone that um, is compliant can't be the same thing. That's where, instead of Paraprotect, that's where I use that POVI one, because it doesn't take any cooperation.
Okay, this was just a comment, but it said no questions, but I realized tonight that I have some sensory input issues of my own, types of music, certain social situations, etc. Just want to say thank you. I now recognize the source. I have learned to manage them, but now it all makes sense.
Yes. So I would encourage all of y'all do two things when you get a chance, and it's great to do with your staffs. Do a DISC personality profile of yourself and your staff. It will help you realize what staff you get along with better, and why there's maybe strife between certain staff members. And also, it will help you understand your patients better, because you will identify, the patients that tell me how much, how long, and when we can start, versus I need a breakdown of everything, and then I'm going to go Google, to make sure you're telling me the truth about it all. Like I said, for me, I'm a D, and those patients that require me to sit there and chat with them about their grandkids and what they did last summer, like, it's draining. But I have to incorporate that time into my schedule, because they need it as a connection point to trust me so I can get my dental treatment done. If that makes sense. It's kind of a full circle. Everybody has to give a little.